Edwin Poots has spent the day on a crusade of damage limitation, trying to quell the public outcry over proposals by health trusts to close residential care homes. He says he's sorry for any distress caused to elderly people, but blames the trusts for the disastrous handling of the proposed changes. Our political correspondent Martina Purdy reports on the politics of the healthcare row.
Skye House, Dromore, one of the residential care homes facing closure. It's not the first time it's made the headlines. Back in 2009, the trust earmarked it for closure, leaving then Health Minister Michael McGimpsey facing fierce criticism. In fact, one of the minister's fiercest critics was the DUP MLA, Edwin Poots. Here he is in the Assembly insisting Michael McGimpsey had got it wrong.
Let's hear what the residents say, because the residents are the people who are most important.
And here he is protesting. But now he's in charge, perhaps the issue doesn't seem so black and white. As minister, the message he sent out in this government video is that the new approach, transforming your care, is right. The policy recommends closing half the residential care homes here, including Skye House. It's what one social policy expert calls a politically awkward moment.
I think the Minister was guided by political thinking there, that there would be votes in resisting the closures of his facilities.
So he's got logic on his side now?
I'm saying he's probably surrounded by people who emphasise the policy realities to him.
Indeed, with the older population set to rise sharply, cost is one of the factors driving the minister's policy. But it's not the only one, says a former trust chairman who last year was sacked by the minister over target failings.
It's expensive to keep elderly folks in residential homes. As well as that, quite a number of the homes are run down. So the alternative seems to be for them that they want to put people in their own home and keep them there as long as possible.
Is that a good idea?
For some people, yes. If you ask elderly people what you would like in the future, it's obvious they're going to say they want to stay in their own home. But it has to be safe when they stay in their own home. And we have to look at how we provide service. Not maybe a third world approach where you get 15 minutes 4 times a day and you do the minimum for people.
Supported housing like this scheme is also key to the plan. Here in Sydenham, an older resident has their own front door, but also access to 24-hour help. The problem, claim critics, is there's a shortage of these developments. Critics say that's not the only problem. Now that most of the trusts are proposing to close all their care homes, there'll be more pressure on the private sector too, a sector struggling to profit on the amount the NHS pays per resident.
Transforming your care is right. But transforming your care, I don't believe it meant that every residential home had to be closed. We can't put all our eggs into the private sector where it's a risk. We don't know what's going to happen in the private sector in the future.
This academic agrees there are risks.
Government need to be sure that the spaces that are lost as NHS facilities close down are actually filled by the private sector. Now, at the moment, the private contractors are at best breaking even. They've been under a huge set of pressures over the past few years.
But in terms of the overall policy, he has this advice for the minister.
I would say stick with it. I think it's a logical policy. Yeah, you don't realise ambitions to provide better quality care by maintaining the residential care facilities operated by the NHS.
Easier said than done in a highly charged environment as elderly residents and their relatives express their distress.
That's very serious. That suggests to me that those people have not been engaged with effectively, haven't been consulted properly, don't feel that they're being listened to and are afraid, and that is entirely unacceptable. It is not acceptable to frighten older people. The amount of upset being communicated to my office is significant.
There's been speculation in political circles that the trusts, frustrated by funding cuts, are putting the pressures back on the minister by maximising closures. But others say this is nonsense.
I don't think the trusts are trying to embarrass the minister. I would believe that the Health and Care Board is doing this with the support of the minister.
Whatever the truth, others have their own theories on what the minister will do next.
We're looking at another U-turn.
Amid the turmoil, the chair of the Health Committee is demanding clarity from the minister.
The minister made a statement. He made a statement a number of weeks ago in the Assembly. 50% will close within 3 to 5 years. He needs to challenge the trust because they don't seem to be taking on board his vision. It doesn't seem to me as if the trusts are listening to what the minister's saying, so who's in charge?